And welcome to the news today on YHC. We're going to get started with a special guest we have today. We have Ashley Hockersmith from Preferred Hospice along with us today, and you're actually the new volunteer coordinator with Preferred Hospice.
Yes, I am.
Sure, so we might be seeing a lot of you in the future.
Possibly.
All right. And you're here to talk about Preferred Hospice today and the hospice services themselves. So tell us what is hospice?
Hospice is comfort care provided to patients with a terminal illness with a prognosis of 6 months or less to live. Our hospice team includes our hospice doctors, nurses, social workers, chaplains, home health aides. Our team focuses on pain and symptom management, as well as emotional support, spiritual and social needs for the family and the patient. And our primary goal is to help the patient make informed choices regarding their final months.
Okay, and we have had some of the chaplains on before that are involved with y'all's services, so that probably ties into the spiritual aspect of hospice. So, that's a very comforting experience for the patients themselves as well.
Yeah, it is. It really is.
Sure, and let's talk about who is actually eligible for hospice. So people will know what services that are provided. Not only that, but who's actually eligible.
Patients diagnosed with a terminal illness or of 6 months or less with that prognosis. If the disease was to follow its normal course with the doctor's order, we can come in and provide an on-site evaluation to determine whether hospice services are appropriate for that patient.
And hospice is typically known as someone that's in their last days, so it's not exactly that way.
Right. We can,
So you're saying 6 months, or within those, close to, or 6 months with the terminal illness.
Right,
so
as long as the disease was to follow its normal progress.
Okay, so it's not just for the ones that are in their last days and need those services. So actually, it's those services are available quite a bit of time before then. So, and when it comes to payment for hospice, who exactly pays for the hospice services?
Medicare pays for hospice, Medicaid, private insurance. There is no deductible. We are also contracted through the VA, so VA will pay for the hospice services as well. We provide meds and equipment like a bed, a hospital bed, oxygen if the patient needs oxygen. As long as these things are related to their terminal diagnosis, hospice will pay for that.
Okay, so some of the areas that Preferred Hospice deals with, probably here locally, you got a local office here in Dexter, so what kind of area do you cover?
We cover 14 counties in southeast Missouri. We cover Dunklin, Pemiscot, New Madrid, Scott, Mississippi, Stoddard, Ripley, Carter, Wayne, Reynolds, Madison, and Bollinger County, and Cape County.
That's quite a territory.
Yeah, I can't remember all of them.
So you got a local office here in Dexter, and I believe one in, is it Farmington?
That's our satellite office, is based out of Farmington. There are 6 preferred hospices in Missouri. There's one in St. Louis, Lexington, Missouri, Ozark, Missouri, Farmington and Dexter, and Columbia. Yeah.
Okay. So anyone living in our viewing area can more than able to be able to take advantage of the services provided by Preferred Hospice.
Absolutely.
So quite a range of coverage there with Preferred Hospice. So that's good to know. Anything else you'd like to share about Preferred Hospice and its services with our viewers today? Just give you a call if any services are needed, I suppose.
Yeah, just give us a call.
Sure, and you can go to. Do we have the number there? Yeah. Okay, there we go. 614-4774. Do we have that right?
Yes.
Okay. All right. That happens from time to time. The number's wrong, but give them a call there, 573-614-4774, Preferred Hospice here locally in Dexter. I actually appreciate you coming on
for
your first time, and hopefully we'll have you for many more times to come.
Maybe I won't be so nervous next time.
The first time is the hardest, and then it's all. You might take over my seat for the.
I don't know about that.
For now.
I don't know about that. I think you do a good job.
All right. Well, it's good to have you along with us, and we'll look forward to seeing you down the road.
Well, thank you.
All right.
Thank you.
And don't go anywhere. I'll be back with your